Hi and hello. This is Dr. Sindhu. I work here as medical officer, and today it's so exciting for me to welcome a stalwart doctor. Welcome, sir. So, how was your experience into this medical field?
Thank you. Thank you, Dr. Sindhu. Thank you for the question. Thank you for your time and being here.
Thank you, sir.
My academic journey, I have to say, it's a typical middle class family story. My parents wanted one of the children to become a doctor.
Okay.
So, and it was between me and my younger brother.
Okay.
So then it was assumed that I will become a doctor.
Okay.
So then I had to go through the entrance exams of writing the entrance exams, both at state level and I wrote a few of the national level exams like AIMS and JIPMER those times. And finally, I ended up getting a medical seat in through merit in Davangere,
Okay.
which is JJ Medical College in Karnataka, through the Karnataka Common Entrance Test. And this was way back in 1993. So we went through the medical course and we finished the medical course in 1998 and we came out as doctors.
Okay.
And as most of the people at the time, I didn't know what I wanted to do after becoming a doctor. So I was wondering, maybe some of my colleagues were certain that they wanted to be surgeons and some of them wanted to be cardiologists. But certainly for me at that point in time when I finished my MBBS and I was doing my house surgeoncy also, I was not very clear which path my career should take. So I was working once I finished my graduation. I was working as a housemanship and I finished my housemanship in Hyderabad. We were living in Hyderabad at the time. Then I started looking for jobs and I joined a government job called Andhra Pradesh Vaidya Vidyana Parishad.
Okay.
And it was in a small town called Rajmundry.
Okay.
So I moved to Rajmundry and there I spent around 6 months. But at that place, actually, I had the time because I was working, I had the time to prepare for the exams in the UK.
Okay.
So I wrote my PLAB exams then and moved to the UK in 2001. By the time I came out of UK, it was 2015. So I spent a good 14 years in the UK in the NHS. So career started in pediatrics, did pediatrics for about 6, 7 years. About 6, 7 years down the line, I realized I was actually spending more time
Okay.
with other people's children than my own children.
That happens.
So what I did, I changed my branch to a more manageable specialty, which was general practice.
Okay.
There was no evening hours or no night shifts in general practice. So we got used to general practice. Thereby, I got to spend more time with my children during their growing years.
Okay.
So I continued my career there and eventually ran my own practice with a few other partners.
Okay.
It was one of the largest practices by size.
Okay.
We served a population of about 30,000 patients.
Okay.
An average GB practice would serve a population of 3,000, 3,500 patients.
Yeah.
So we were 10 times the size of an average. And I was one of the senior partners when we came out, when I decided to come back to India. So that was my journey, academic journey, till I came back to India. I came back to India in 2015.
Okay.
Then my idea was to replicate the general practice, which was what I was managing in the UK, and I was very comfortable with general practice. In UK, we call the general practice cradle to grave.
Okay.
So right from the birth of newborn baby all the way till your death, you are being looked after by the general practitioner.
Okay.
So everything in between is being covered by the general practitioner. Usually, you do your home visits. We do palliative care at home.
Okay.
So there was this huge lacuna in India, or because general practitioners are actually like gold dust in India. So you can't find a good general practitioner.
Yeah.
So a lot of my colleagues suggested, well, you've got a pediatric degree, you've got the degree. Why don't you practice? Market yourself as a difference. So I said, no, let us stick to what I'm happy with practicing.
Yeah.
So we started this place 2015 and did general practice the way I have known to do general practice, and then it has proved to be a hit among the local area population, and also nowadays we get patients from far and wide.
Okay.
For who knows for the work what we do.
It's so nice to hear all these things from you, sir. Sir, actually, when I had come into this hospital, I could see a complete professional zone with good ambience and atmosphere. So it completely got impressed. And it's so nice to see it, sir. So, how was the setup done? So, could you explain to us regarding the setup?
Yes, again, the whole thought process when we set this up was we need to have right space for
Okay.
everything
Yeah.
what we wanted. I wanted to follow the 5S model, So it's a Japanese thing where everything has to be in the right place at the right time, so easy of access and all those things. The neatness is something which we have always been around, no, right from our childhood. We have always been in a setup which whatever is that we've been taught, cleanliness is next to godliness, and so we wanted to follow that. In fact, when we set this up about 10 years back, in this entire segment on this main road of the East Coast Road,
Okay.
there wasn't any other clinic which was like this.
Okay.
So, and that in itself is good to know that we have managed to set it up like this. And then what happens now, as you see it now, when you have joined us recently,
Yeah.
when you have seen it, we have ventured into naturopathic therapies and some certain other Ayush modalities of treatment has been incorporated into this practice. This turnaround came to me after I came back to India when this hospital was being actually revamped. It was previously a furniture store.
Okay.
And when we were revamping it, I had about 2 to 3 weeks or 4 weeks on my hands.
Okay.
So I went to an ashram in Kerala,
Oh.
and the program was called Yoga Vacation.
Mm.
It was a 2 week program.
Okay.
So I thought, well, I mean, they say it's a vacation. So I assumed it was a vacation. But I think the word yoga took more precedence. So there, what they were doing to us was we had a schedule where we had to get up at 6 o'clock in the morning.
Yeah.
And you had to sit for meditation till half an hour. Then there was chanting for an hour. Okay. Then your first session of yoga in the day starts at 8 and goes till 10. Okay. You are given a first meal at 10 a.m. Okay. And then you have another session of yoga. You have a few things karma yoga during the day. Then you have a second session of yoga in the afternoon, 3 to 5 or 5:30. Okay. So in a day we were doing 4.5 hours of yoga. Okay. So after doing that for about 2 weeks, my entire perception changed. Okay. And the second thing I saw there was an Ayurvedic outpost. There was a doctor, senior Ayurvedic practitioner in Panchakarma treatments. And I went and just saw that. I knew Ayurveda is a specialty in its own right. So I didn't know what they were doing. So when I went and sat there with him and we were speaking, he was a very upfront and forthcoming, and he was explaining the patients he was treating, and we were discussing some of the patients. In fact, after that, we started discussing his mother-in-law's case and so on and so forth. And then we were doing sort of, a combined form of modality of thinking, at least on the combined lines. He was using Ayurvedic modalities to treat his patients. And I was seeing patients coming with chronic ailments like chronic skin diseases, chronic gut-related diseases, and the demographic of the patients. They used to have a lot of foreigners come. The foreigners, they are usually interested in yoga. They come for the yoga bit, and when they find out the Ayurvedic bit, they actually spend a month or longer there to get both the things going for them. So, and that was my exposure to the alternative, or I should say, Ayush modalities of treatment. That got me interested in those other therapies, okay, which over a period of time we have taken it in a various different versions, and we are practicing it here.
And sir, after like I've been known you, like you have been into your travel modes, and your career was there, your studies was there. So combining everything, like what kind of modality made you to practice in India, and what was the thing which impressed you actually?
So one of the things what happens is when you are abroad, you are not exposed to any of these holistic alternative therapies, naturopathic modalities of therapies are very limited. Okay. As an allopathic practitioner. Whereas in India, you are actually even the patients who come to see you, they say, "Sir, we have gone and seen an Ayurvedic practitioner, we have gone and seen a homeopathic practitioner, we have gone and seen Siddha practitioner or an acupuncture practitioner." So we have to and then we hear from them whether it has been useful for them, and if it has been how, and if it's been useful, how useful it has been. So when we have started planning the treatments, we plan the treatments keeping in view that these modalities of treatment, they will go. Whether you like it or not, the patient is always the king, and he makes up his mind. He or she makes up his mind, and he says, "I will have this modality of treatment plus this one, and I will see how it works." So instead of us telling them, "No, you don't. You just try this or try that," we try to incorporate everything and give them the best option. And so much so that over a period of time, there are some local practitioners here whom we work very closely with. Okay. And the patient is very happy to combine both modes of treatment and then continue following it as long as he's getting the results. Now, this is something which the government is also trying to push with this integration, yeah, of medical specialities across board. They want the allopathic doctors and the Ayush doctors to work together. I have even seen in some of the medical colleges where I visited, Whitefield, got an Ayurvedic OP. Okay. Alongside your outpatient setup. Okay. So the patients can get the benefit of both the worlds. So it's great to know such things from you, sir. How does your practice involve using all these Ayush modalities, and what management you are comfortable with in regards with this Ayush modalities, sir? When we start off with a patient, it's always we've been taught history taking, which is what we do. We do a very good history taking. We run our blood samples and we interpret the blood samples as per our given values in allopathic science, which we tend to do. We come to a reasonable, a working diagnosis, a reasonable diagnosis, and then we are thinking about how best we can serve this patient in terms of the options, what we can give to them. Is it purely our allopathic medicines, or is there any form of any other form of medicine? For example, if we think about a person who has got mental health issues, there are usually certain flower remedies, yeah, in homeopathy which help them well, and homeopathic medications help them well. And if there are any, if they pain people, if there are any patients who are suffering from joint pains and aches and pains, there are certain Ayurvedic oils, the thylums, which and the massages and the things which they put around the joint and tie it, and those kind of therapies which can also help along with our medications. So it is a completely an individualized or a personalized medical journey we take the patient through in our sort of a treatment setting. So that way they get the most benefit from whatever therapies we are offering, and they don't have to come back again for the same problem once they are cured. So again, to start with, like, you have been working here in India, and you have been abroad also, and you have traveled to many places. So what is the unique style of difference you feel like while you are on practicing here, sir? So the practice is definitely different whether you're practicing in UK and NHS compared to practicing in India. And when you again compare practices in the West, for example, US or in Australia and things. For a start, I would say the systems, the Indian practice has come of age. It has improved a great deal compared to the times when we went abroad 20, 25 years ago. There has been a seismic shift in the modalities of investigations and the therapies available in India, the costings available in India. So it is actually, I'm happy that I have made my decision to come back and I'm practicing here, because I'm able to serve public or the patients with whatever modality of treatment. Okay. One is the modalities of treatment, such as including the holistic modalities of treatment we can incorporate in our allopathic practice. And the cost of such treatments compared to the Western countries is much more affordable. Yeah. Even the cost of the certain allopathic medications, the cancer drugs, and so on and so forth, which is very expensive in the Western economy, is made available to our Indian patients. So actually, if you look at the waiting time, say for example, if you want to see a GP or if you want to get an MRI, yeah, the waiting time is 3 months in the UK. If you want to get an MRI scan of your lower back for back pain, And if you want to see a GP, the waiting time may be a few days to a week. The beauty in Indian system is you are able to see a doctor the same day, and if the doctor feels he or she feels it needs investigation, it needs hospitalization, everything is being managed very well. And even I have to say, even during the COVID times, our country's infrastructure, the medical infrastructure, handled the crisis very well, and we were definitely better geared up compared to a lot of the Western medical economies, which fell short of expectations of care. So I'm happy to be practicing in India. I'm happy to be practicing in the country which is actually at the cutting edge of technology, of infrastructure, and the future looks exciting, incorporating AI and other forms of current IT technology into the medical field is bound to do good for the patients going forward.
Actually interested to know all these things. How do you feel like the benefits of these therapies, and what kind of therapies you are comfortable to practice, and you have been following them? So all these things, how far you feel that it has a good scope for these kind of particular diseases or conditions like that?
I think a lot of these modalities of treatment, what we will be discussing further later on, will be applicable to most of the population in general.
Okay.
People with chronic ailments,
Okay.
people with majority of things, what they have actually done.
Okay.
In allopathy, there are a group of patients who have gone through their treatment in allopathic medicine, but they're not able to find answers.
Okay.
Now, that is when we actually go to the root cause analysis. We actually want to go to the root cause and find out what is actually causing the problem and how we can address the problem. So, these therapies, what you're talking about, most of the therapies try to address the root cause.
Okay.
So, say for example, if we do find a problem with the gut, we want to try and address the issue with the gut. We try and find a problem with the liver. The liver may not be the primary issue. The primary issue may be somewhere else. So unless we address the primary issue with the liver, it may be a problem with the cholesterol abnormalities. So even then, we cannot address just the cholesterol imbalances by giving you a statin or something. We have to understand why there are cholesterol imbalances, why the sugar is abnormal. Rather than just giving a chemical to get those numbers all right, we should go down to the root cause and try and address the underlying issues. So once we address the underlying issues, a lot of the times, a lot of the parameters get better by itself. So that is the aim in following these different modalities. Again, we don't want to stick to one modality and say this is actually the best form of treatment. We would like to employ all the parameters. So it's like having a quiver full of arrows. You pick the arrow which suits that particular illness, and then you use it.
Okay.
The tools are plenty, so you use one or a combination of tools which helps that particular patient in that condition. And we can standardize some of these as we go along.
Okay.
But that will need evidence-based practice, which will take time, and eventually it will come.
Yeah.
With the government's push towards integration, and hopefully this government continues to does the same thing going forward. The central government's continuing push towards integration of various modalities.
Yeah.
We will be able to take this forward. Eventually, it will be beneficial for the patient.
Yes. Thank you so much, sir. It was nice and interesting. And of course, I know all the viewers had some queries running across over their minds. So I think a bit has been clarified here. And in the upcoming videos, we will be having so much of interesting topics and exciting topics are waiting for us here. It's a great opportunity for me to have golden chance like this. And thank you so much for sparing us your time.
Thank you.
Thank you.
Thank you.
Thank you.